and welcome. You're watching FYI. I'm Sonal Mehrotra Kapoor. Now, a couple of days ago, we did an episode on how heart attacks were becoming more silent. What was leading to these heart attacks? Why were they happening in the young as well? And as a response and feedback, a lot of you wrote to us asking us to do a show on cholesterol levels altogether. So, well, we are here solving all your queries. On the program today, we'll give you a full explainer on what exactly is cholesterol, what does it do to your body, what are the different kinds of cholesterol as well. Basically, all you really need to know about cholesterol and how it impacts your body. Also joining us in an extremely nice panel, which will be taking all your questions as well. So without any further delay, let's get started with our explainer. So firstly, why is cholesterol really needed in your body? Well, it's needed to build healthy cells, vitamins, hormones as well. A lot of people think cholesterol is all fat, but that's really not the case. Vitamin D rides on it. There are several other things that actually ride on cholesterol if it is the right kind of cholesterol. So the right kind of cholesterol is extremely good for your health. It's only the bad kind and the excess of which can pose several problems. We're talking about different kinds. We thought let's break it down for you on how many types of cholesterols are really there which are constantly moving and circling your blood streams. So one, there is a good cholesterol, and we all know that by now, your HDL, also known as high density lipoprotein. Then there is the bad cholesterol, which is called LDL, that is low density lipoprotein, and then there is the very bad cholesterol, or something which is called a very low density lipoprotein, that's VLDL. And then something that is even worse, that is called triglycerides. Now, what exactly are they? It's like three kinds of fatty acids that actually come together. Let's not get into the complications here, but these are basically, this is also be the breakup that you see if you go and get your lipid profile tests, etc. done as well. So these are the cholesterol levels. So always remember that the amount of HDL in your bloodstream should actually be high, and as you go down that list, it should keep reducing for you to have a healthy body. Alright, but what causes high cholesterol levels? Well, unhealthy lifestyle, family genes play a huge role. Medication for thyroid patients have to be very careful. Remember, they're already on blood thinners, etc., because it can lead to your instability in cholesterol levels as well. And of course, if you're a kidney patient, you need to be very clear about that. Liver patients as well. Now, also, a lot of us get tests done to know our cholesterol levels, but are there any indicators that you have high cholesterol levels or high amount of bad cholesterol levels? Let's put it that way. Well, if you have chest pain or chest burn, nausea, extreme fatigue, shortness of breath, you get sudden pain that can get more sort of too much to handle in your neck, in your jaw, in your upper abdomen or your back, it's a good thing and an indicator that you should get your lipid profile done and get a check on all the numbers as well. If you suddenly get numbness or coldness in your extremities as well, then also it's a good idea to consult your doctor and let him know this is happening. He will probably advise you depending on your family history. And like I keep saying, every individual, every human being is going to be different. So do consult your doctor when you are feeling these symptoms as well. So how to check cholesterol levels next, right? Your doctor will ask you to probably do that. He will ask you to do a full lipid profile screening. Cholesterol screening is overall will give you a look of how much fat is really there in your bloodstream, whether it's healthy, unhealthy, etc. But if you do come out with high cholesterol levels, like I said, don't get paranoid about it. Also remember to see which kind of cholesterol is actually spiking in your body. If it is the bad kind, that's when you need to start exercising. Lifestyle change is extremely important here, at least 5 times a week, doctor's advice. Avoid saturated fats, quit smoking if you haven't already. Lose weight, eat healthy. Basically, don't eat anything that is coming out of a packet which is filled with preservatives and perhaps lots of trans fats that you're not even aware of, deep fried stuff as well. And then of course, as they say, manage stress. That is also go a huge way in your health, both physical and mental. Generally, people who have high cholesterol levels are asked to limit their sugar, fatty, salty intakes altogether. They are asked to replace foods containing saturated fats and trans fats. They're asked to include food that has high fiber like fruits, vegetables, whole grains, nuts as well. Now, a lot of people think nuts are bad for cholesterol, but that's not entirely the case. We'll explore that with our panel as well. coconut oil, butter, etc., deep fried stuff, absolute no-no if you have a family tendency of having high cholesterol levels as well. Also, a lot of people say, oh, it's baked, it's air fried, etc. Well, pies, biscuits, buns, again, they don't have whole foods, less fiber, so please stay away from that as well. In lifestyle modifications, if you have lower levels, modifications to lower your high cholesterol levels, well, like we said, avoid tobacco altogether, change the way you're eating again and again. That's what keep emerging out of all the guidelines that doctors give you and advice that comes from their way as well. Okay, having understood that, let's go to our panel now. We've got Dr. Dheer with us back on the program. We've got Dr. Ajay Narayan as well, Director Global Health Alliance from UK. Dr. Balbir Singh also back with us on the channel, and Dr. Dwivedi joins us, Assistant Professor for Cardiology, and she joins us from NYC. Let me begin with Dr. Dheer then. Dr. Dheer, I've given out a very basic understanding of what cholesterol is without getting into the details of, how cholesterol itself is not all fat. It's actually a protein plus fat and how it keeps deteriorating as you look at different levels. But a lot of time, very healthy people, athletes also, who are constantly exercising, end up having high cholesterol. Why does that happen?
So, very good question you have asked. See, it totally depends on the enzymatic metabolism of the body. It varies from person to person. You already said just now that there are certain genes which can cause. There is basically an enzymatic deficiency which causes inappropriate metabolism of the cholesterol we take. So it is not exercise. Exercise alone increases the good cholesterol, HDL. But it is the assimilation of the bad cholesterol. How metabolism? You rightly said that hypothyroid patients, they have high cholesterol because their basic metabolism is slow. So you have to work on the things which increase your metabolism. So I say a dictum: eat less, eat more, eat more, eat less. So if you take small meals for diabetic patients regularly, your metabolism will be high. Even if you take a good diet, your cholesterol will not peak to the level if you remain fasting for long. So you have to induce certain things in the body. Exercise is one such thing. Reducing the stress is another thing. Avoiding tobacco. These are indirect ways which improves the metabolism and lower the blood bad cholesterol.
Right.
But like hypertriglyceridemia, it runs in families. So they have heart disease as well as liver disease. So they have to have that medicine. Don't consider taking that medicine as if you are diseased. Take it as a supplement. You have some deficiency. Yeah.
Okay. Let me bring in Dr. Singh in this conversation now. Dr. Singh, we were talking about this when we discussed heart attacks as well, right? How much of an impact does cholesterol have, or high levels of bad cholesterol have on your health, and what can it actually lead to?
Okay, so my answer is very simple. LDL is the driver of atherosclerosis. So atherosclerosis is deposit of cholesterol within the vessels. So in my opinion, LDL is the worst cholesterol. I saw your chart. I would not agree that ELDL is the worst enemy. We have LDL as our worst enemy. And LDL is the driver of atherosclerosis. I will give you an example.
Okay.
When a neonate is born, the LDL cholesterol in the body of a neonate on day 1 of life is 30 milligrams per cent. A primate, a monkey, has LDL cholesterol of 30 to 40. God did not want us to have atherosclerosis. We have given it to ourselves by making this LDL cholesterol from what it should be around 30-40 to in hundreds. So most of Indians have LDL cholesterol in hundreds, some above 150. If you ask me, what is the lower limit of LDL cholesterol, where obviously LDL is there, so it has some function to do in the body. Is there any function which gets disturbed by having very low LDL? None. In fact, higher the LDL, all the problems. Lower the LDL, there has been no adverse effect found. So we don't even know how low the LDL should be. So LDL is the driver of atherosclerosis and coronary disease. There is no doubt about it.
You're saying LDL is actually more harmful and worse off than even triglycerides?
Yes, LDL is the major culprit. We have triglycerides which can go to 400 and above. They cause more disturbance in the pancreas. They cause less disturbance in the heart. So triglyceride is less of an evil for heart as compared to the LDL. LDL is the key driver of atherosclerosis.
I see. So essentially you're saying anything apart from HDL is something which is bad. So the lower the level, the better it's going to be.
Right.
Let me take that question.
I'll add to this that how this research happened. It started with the Birmingham study. They looked at patients who had heart disease and they compared the LDL levels in these patients to those patients who did not have. And there was a clear, remarkable difference. Then the studies came on prevention of reducing LDL and whether you could prevent coronary disease. Yes. The answer was yes. Then came in studies how low to get it down, and lower the better.
Just pause there. Tell me how to reduce LDL. That's what everybody needs to know and wants to know.
If you ask me, diet and exercises will contribute to 10% of LDL reduction. The statins are the wonder drugs. I think statins are abused in the WhatsApp groups, but are the wonder drugs in the last 3 decades. One should not fear them. They are great drugs. They save so many lives. Let me tell you my secret. 20 years I've been on statins without any side effects. So they are drugs
We've got a brand
which many normal human beings are going to have.
Right. Interesting to know that. Let me go to Dr. Narayan on that note. Then Dr. Narayan, it sounds so generic when you actually tell people exercise, eat the right kind of food and, get your cholesterol levels under check. But so difficult to actually implement. I mean, I don't even want to get started with diets because there are so many fad diets that are really doing the rounds across the world, leave India at this point. But specifically to keep your bad cholesterol in check, what do you recommend people to do?
I think thank you so much for having me on the show. And I think the most important message that should go out to the public, a very basic general message that should be out there is one, exercise is very important. The European Society of Cardiology now says 150 minutes of moderate intensity exercise per week is very, very important to prevent any kind of cardiovascular event. So that's number one. Number two, it is also important to eat lots of fruits and vegetables because that is how you are going to increase your fiber intake and that is how you are going to get rid of the cholesterol. Number three, there is lots of evidence for nuts, as you mentioned in your earlier in your program. So again, nuts is also very, very important. Fruits, nuts, vegetables, healthy lifestyle, lots of exercise, as I said. Those are the important things to consider. But obviously, if your LDL is still high, if your triglyceride is still high, if you've got family history of high cholesterol, which again is can happen in a lot of Indians and do happens. And as Dr. Singh mentioned, that unfortunately that we have to be on statins, small dose of statins, and that is the wonder drug that will prevent, that will regress, that will stop any kind of blockages to happen and cause any kind of heart attack, stroke, or any cardiovascular events in the future. So I think statins is definitely required in some of the cases, especially when your cholesterol or LDL levels are not up to the mark and you're trying to bring it down as low as possible.
We've got 2 endorsements over there for statins over there. I have 1 minute before I go into a break. I just quickly want to give that to Dr. Trivedi, who's been waiting patiently as well. Dr. Trivedi, why, we've talked about this in the previous episode for FYI as well, that why is it that Indians are prone to having more heart diseases or prone to having higher cholesterol levels?
Yes, Sonal, definitely. I think we have a certain genetic makeup and we cannot fight that. So we know from studies, including, studies that have looked at multi-ethnicity data, that Indians are at a higher risk for heart disease as well as high cholesterol. Added to that, I think our lifestyle these days doesn't help at all. We have become more sedentary over time. Our food habits have changed from cooking meals at home to takeouts and eating more processed food. So I think it's just adding insult to the injury here. Last thing I just quickly want to mention as a female panelist here is that when women reach menopause, we actually lose the benefit of estrogen in our body, which actually increases your bad cholesterol and decreases your good cholesterol. So when women around the age of menopause should be specifically careful about their cholesterol levels, because throughout our life, we're actually protected from the estrogen. But when we lose it, we become at equal danger of heart disease as men.
All right, that's a good thing to note over there. A short break. When we come back, we'll continue the discussion. Stay tuned to FYI. Welcome back. We're discussing all you need to know about cholesterol, and we've got some time left to go back to our panel as well. Let me go back to Dr. Dheer on that. Now, Dr. Dheer, especially in younger people, what exactly are the trends that you're seeing when it comes to cholesterol? I keep saying this. I see two categories of young people. One who don't care about their health at all and are happy to just be couch potatoes. And there are the others who are so obsessed with the idea of fitness that there seems to be no sense of balance over there as well. So what is your advice to young people who are trying to keep a check on their cholesterol and perhaps have a family history as well?
So I would start with that. Excess of everything is bad. Be it sitting, be it exercising. So you have to follow the middle path. And as far as cholesterol is concerned, there is a myth that we Indians are vegetarians. And we take a lot of vegetables and fruits. But mind you, our consumption of fruits and vegetable is very less. And those of who are taking vegetables, they fry it so much that the adequate properties of those vegetables are completely lost. Second thing, we have an alibi. Today only I saw the patient. Kehta sahab, main to kuch khata nahi hu. I don't eat anything fried, except I take aloo tikki that is fried in olive oil. See, we have to break this myth. Anything which is deep fried, it's not olive oil which is going to protect you. It is the habit which you have to. And in Indians, we have seen high cholesterol oblique HDL ratio. Our HDLs are very low. So couch potatoes will have high HDL. And second myth, I want to break that HDL is considered a good cholesterol. But even excess of HDL is also harmful to the body.
I see.
It is equally not. Dr. Balbir was saying that statins, that is what statins has to be taken. But all those families who have low HDLs, who have a strong family history, the only thing which can benefit them, what I say is, once you are having your meat, it should comprise all the colors of foods which are there in the rain.
Right.
So you have yellow colored vegetable, red colored vegetables, good amount of nuts, hazelnut, walnut, these are good. But excess of these nuts are also bad.
Right. But talking about food moderation, Dr. Narayan, do you want to weigh in on this? A lot of time, the myth really doing the rounds is that if you're a non-vegetarian, if you eat too many eggs, etc., you're likely to have high cholesterol levels.
Yeah, so again, there has been a lot of myth about, especially about egg yolk and white portion, yellow portion, what is good, what is bad. And there are lots of research around this, but I think in moderation, few times a week is not harmful for you and your body. But obviously, if you start eating few eggs every day, then that obviously lead to high degree of cholesterol. But most important, I think we need to know and understand is that we need to have moderation of everything. So, you know, for alcohol, for example, again, alcohol is very bad for your cholesterol. Smoking is very bad for your cholesterol. Again, having mild degree of hypercholesteremia and smoking and alcohol together is a big danger for heart attack. So again, there's not only about lifestyle, diet and food and exercise. You will have to give up smoking. You have to cut down on your alcohol intake. The
I saw Dr. Singh shake his head when you were saying that. You have a point, Doc?
Yeah, so I just wanted to add about alcohol. So patients come and tell me that alcohol is protective. On the contrary, all the studies in India have shown alcohol has not been protective and can be harmful because the way we drink.
So what about having
India,
a glass of wine every day is supposed to be good for your heart?
So Sonal, the way Indians drink, they do binge drinking. You see the kind of snacks they have with the drinks. And nobody stops at one drink of wine. I've seen that several times. They start with one, okay, we'll have only one, and you end up seeing them have the third or fourth. It is very difficult. I have seen people drink on weekends, and that is binge drinking. They drink a lot and eat a lot. So I don't buy into this people telling me that alcohol is protective to the heart. So moderation, yes, one glass of wine, if somebody can stick to that, I would say it's moderation. But very difficult to control many of the patients who come to us and say that alcohol is protective. It isn't.
Right. Okay, I really wanted to go to Dr. Dwivedi as well, but my director is telling me that the time is over on the program, so I'm really sorry over there. But thank you all so much for your time and bringing in the much needed perspective on cholesterol as well. We'll keep doing these shows, and perhaps gut health is going to be next on our radar as well. So stay tuned for that coming up on FYI. That's it from today. Bye-bye.